Hi, this is Dr. J with Dental Masters, and we are here to bring tips to you that will help you with your oral health and your smile. And today we're going to talk about a myth that exists, and it is, if I don't see it, I don't feel it, it doesn't hurt, it must not be there. So let's talk about medicine, general medicine. Very often there can be conditions like cancer that exist and they're occurring in someone's body. They don't feel it or see it until, unfortunately, it is so far along till it's gotten to stage 3 or stage 4, and now you need invasive chemotherapy and radiation or surgery, and sometimes they're not even operable. And that's a super sad situation because there was no signs or symptoms, especially if someone's not getting their regular checkups. So with dentistry, I want to give you 2 examples where there are signs that can occur that you would not feel, you would not see, and it wouldn't hurt, that could cause more damaging issues that create more need for treatment that's more expensive, more involved, and affects your quality of life. So the first example would be cracked tooth. So you come in for your hygiene visit. You're supposed to come in every 6 months, but it's been a year. Everything is fine. You go through the cleaning. It's going great. Dentist comes in, brings out one of those little wands, takes a picture, and says, you've got a crack in your molar, and we need to put a crown on that, or something called an onlay. We need to protect that tooth, and shows you a treatment plan for, I don't know, $1,500. Just making this up. It's a common scenario though, right? So that crack could actually, and very often we see these cracks extend, where either a piece of the tooth shears off. Worse, the crack gets longer and goes into the nerve, and now you need a root canal. Even worse, the crack goes and spreads down beneath the bone, and you have to have the tooth extracted, and maybe you lost some bone because the crack is there and the body's trying to get rid of it, so it sends out inflammatory cells and it starts to eat away at the bone. So what am I saying basically? When you get that diagnosis or description of cracked tooth and the dentist is telling you that you need something to address it like a crown, ask questions, take a look at the picture, have him show you or her show you, how is this going to affect me? What is the prognosis, or what is the risk that this will affect me in the future? And sometimes there's no answer. How long can I leave it? That's another question I get. The only thing I can tell people for that is, I don't know how long, but it's not going to get better, so time is not on your side. So that's example number 1, cracked tooth. Ask questions. If you need to get a second opinion, get a second opinion. Another example is infection in the bone. So very often a tooth that has either been traumatized, that could be an elbow in basketball, my favorite sport, or it could be the other way, from a large cavity that you have a silver filling, and then maybe it had a crown, and everything feels okay. You come in one day and the dentist says, oh, we've got an infection here. And there's a shadow, a little tiny shadow on the x-ray. Sometimes you can't even see the shadow on the x-ray. The other day, we had to use 3D technology, and I was looking on a patient on one side of the mouth, and because we used a 3D scan on the other side, where the x-rays didn't show anything, I saw a centimeter cyst or infection that had turned into a cyst where the tooth had to be removed. And we had to do some bone grafting. We had to build the bone back up because there was a big hole there. And we had to put an implant in. So when these things are being told to you, ask for more information. If the dentist has a 3D CAT scan, as we do, or other dentists do, and they tell you that you have an infection, you need a root canal, and or you need to have a tooth taken out, say, can I get a scan? Can you show me? And again, if it's not explained well enough, get a second opinion. These things are problems that could start off small. They can be picked up and they can be treated with something a lot simpler than an implant or a bone graft. And even to some extent, if it stays, it can even affect your overall wellness. It can affect your immune system. These infections I've seen spread to the point where it's come all the way up and made someone's eye close up. They were a couple days away from that spreading that way. And you know it's that way is the brain. Or on the bottom, I've seen it where their face was this big and they were a couple days away from it going that way. What's that way is your airway. So when these things get closed off or impinged on with infection, it can be a bigger problem. Does it happen often? No. But do you want it to happen to you? Absolutely not. So again, the myth, if it doesn't hurt, I don't see it, I don't feel it, then it must not exist. So I don't need to do anything about it. That's the myth. Make sure you ask questions. I'm very serious here. Get a second opinion, get more information, get informed, advocate for yourself. It's very important. Hopefully these tips were helpful. If you like the information that you heard, go ahead and hit the like or subscribe button. And I look forward to bringing more information to you in the future. Keeping smiles white and healthy, and have a great day.